Okay. So today's session, COVID-19 and child care, what you want to know, it's being recorded. Our interactive workshop will not present in full content CDC child care reopening guidance, but for your reference, we will post links so that anyone interested in referencing the guidance can do so, and best practice as well. We invite you to put on your trauma-informed lenses and think about how the new health and safety protocols may or may not support the social and emotional needs of children, especially those who've experienced trauma. Some may be aware that children who have experienced trauma may have difficulty expressing and processing their feelings and stress. Their brains may be in a constant state of hyperarousal, making it difficult for them to trust, build relationships, self-regulate, and feel safe. With this backdrop, we'll look at the COVID-19 child care health and safety protocols and invite parents, child care providers, shelter staff to begin thinking about how they can proactively advocate and plan for the social and emotional needs of children before and while enrolled in child care. Desire is to foster resilience during uncertain and uncharted times. So again, my name is Dawn Knock. For those who missed the introductions, I am an early childhood education specialist with the BELL project, which is Building Early Links to Learning. With that as our backdrop, I'm going to go through our agenda and tell you a little bit about who's on the call and what their role is. We are going to have an interactive session. We're going to play. So we know that children learn through play, and we believe adults can learn through play as well. We're going to have a Q&A period, and at any given time, our resident mental health consultant or therapist with PEC, who is Jeanette Cole, she will be providing support and guidance as it relates to trauma, its impact, and any questions that you might have for her. She has graciously agreed to join this call. So thank you, Jeanette, yay. And we've also asked and invited Eunice Bay, who is the executive for Grace Ferry Early Learning Academy. She is going to share with us, she's a child care director of a Star 4 program, and she has insight as to what COVID experiences have had on her children. And I've invited her to come in and share and answer questions that you might have from the field. And then we're going to provide tips for the journey. So parents and childcare providers, but this is mostly geared towards equipping our parents with the understanding and shelter staff so that you can help best support your parents and how to prepare for this re-entry, this reopening. Then we're going to have a cheer and a challenge from Marilyn Edmond, case manager for PHMC. And then we're going to have a closing brain break. And that's a little game that we'll play with you. Okay, so if you don't mind, let's get your phones out. And before, I forgot to tell you, we're going to do our mental health check-in. Okay, we have a poll that we're going to do, and this poll is an anonymous poll, so it should only take a few minutes. And what we want to do is see how you're doing. And then I'm going to take a segue from here and ask everyone to go into the poll. But while you're waiting for the poll, I'm going to post this. Can you see this? Pull up on your phone while you're waiting for the poll to post, www.kahoot.it. And Kahoot is KAHOOT.it. All right. And then I'm going to stop sharing and go to our poll. Okay. So if you wouldn't mind taking a moment and doing a check-in and tell us how you're doing. Okay, we have a few more. If you wouldn't mind checking in with us if you can. If not, I'll give you 2 more seconds, 1 more second, and I'm going to end the poll and see how everybody's doing. So on our mental health check-in, we have the majority of us are saying we're okay, you know, and the rest are kind of saying I'm okay-ish. All right. And there's a few outstanding ones that are out there that says I'm doing great. I'm coming over where you are because I want some of that positive energy. All right. So did you guys see the results? Okay. All right. So I am going to share my screen again. All right. I think this is it. Nope. Yeah. Oh, they are little. Be patient with us. What happens, guys, we found that this link will always try and take us back to the promotional. And we don't want the promotional. We want our game. All right, let's see if it allows us to play. For those who are just joining us, if you wouldn't mind pulling out your phone. Okay. For those who just joined us, if you wouldn't mind pulling out your phone and pulling up www.kahoot.it, and it's spelled KAHOOT.it on your phone, and log in. You can give yourself your a nickname. You can give yourself, and when you see it says your game pin, and it's the number at the top of the screen, 6819807, and you put that in, you enter, give yourself a nickname, and or you can use your regular name if you want, and then plug in go. And as everybody puts in their name, then we'll be able to, we have 7 participants already. Now we have 9. So I know we have 22 people on the call. So I'm going to give people some time to pull it up on their phone. And so what this game is not gonna, it's not gonna put anybody on the spot. It's gonna be a way, and I'm hoping people will be able to hear and ask questions about the protocols as a result of the game. And I'll start the game in 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and feel free to jump in as you can. And I believe you'll be able to just jump in we have 6 questions. All right. So here we go. Question number 1. How do you find a high quality early child care program? And I'm really hoping that our parents will take part of this question. Do you ask your case manager or friend? Do you look it up online? Do you go to the closest one to you? Do you go to the one with the cutest characters on their window? All right, so the true answer to this is look it up online. While we know that families in shelter may have several resources available to them, and we do advise that you go to your case manager and you do ask your friends, because we know that word of mouth is a good way of learning about a program. High quality programs, once you leave shelter, you may not have access to knowing how to find one. And so we encourage you to use the Compass website. It will tell you if a program is a star 3 or a star 4. And we realize that high quality childcare programs have a higher impact or a greater impact on the needs of children that have experienced trauma and for children in general. But looking it up online and finding out things such as their stars rating, you can even go in and look at their inspections and see if there were any alerts or concerns that you might want to be informed about. Also, we know that it's close, it's convenient to go to one that's right across the street from you, right across the street from a shelter, but the closest might not represent quality. Convenience, you don't want to trade off for quality. So we want you not to look at the cute characters on the windows. While it might be, very exciting to look at a cute character, but that does not indicate quality. All right, so I don't think we have any questions with that one. So we're going to see how we fared. Who won? First in was Eunice Bay to plug in. And then, so on that particular question, we see our rankings. Okay, so this is going to score you guys as we go along. All right. You see our top 5 contenders. Question number 2. When enrolling during COVID-19, you should ask what their hours are, ask what their sick policy is, ask how often they clean, disinfect, and wash their hands. Maybe you say, I'm going to ask them all. What's your answer? All right. So let's see what the real answer is. Sarah?
Yes. So when enrolling during COVID-19, you should absolutely ask all of these questions. Many childcare programs have changed their hours during this pandemic. And sometimes their websites don't reflect that change in hours. So it's really important to call and to figure out when they open. Can you guys hear that construction? I'm so sorry. It's really important to figure out when they open every day and when they close. That just started as I started speaking. Definitely ask how often they clean, disinfect, and wash hands. in the program that you want to help a family enroll their child in, or if you want to enroll your own child. They should be doing these things very frequently. Every classroom should be disinfected top to bottom at least once a day. And after a child is finished playing with a toy or a station, that toy and station should also be disinfected. And then of course you want to know what their sick policy is, especially as we move into cold and flu season. You want to make sure that that program has a plan for dealing with a child who is sick or who, God forbid, tests positive for COVID-19. So if a program sounds like they don't have a solid plan, that might be a concern for you. You want to make sure that the child is in the safest environment possible. I will mute myself.
Thank you, Sarah. Now let's see who's in the lead. Eunice, you were replaced by Michelle. Okay, we still here, but she's still the top 5 contender. All right, now Jeanette, you coming up in the ranks as well. Now let's see, question number 3. When dropping off during COVID-19, what are your answers? You may experience some form, your child, may experience some form of fear or anxiety. You will be able to sit in your child's classroom. Your child's temperature will be taken. I believe red and blue are true. What's your answer? All right, so the correct answer is I believe red and blue are true. Now let's look at this. Your child may experience some form of fear and anxiety, which is one of the reasons why we're here. We have to realize that COVID-19 presents children and families and childcare programs with a unique protocol, which is our families are coming and entering the program with our children are coming to school with masks on, and families are dropping off at the door. Children are being escorted into a classroom and in a program that they may not be familiar with. And for the first time, you are actually handing over your treasured life, your loved one, into the hands of what you feel are trusted strangers. But think of that from the lens of a child. And we're going to talk about this all later after this game. And what type of anxiety and fear that can ignite in a child that already is hyper aroused because of trauma. Your child's temperature will be taken. Yes, that is a part of the CDC protocols. Wherein before the CDC protocols, you may have been able to go inside of the school, sit with your child, provide them with some form of comfort and reassurance inside of that classroom on their first day of school. Now, children are being asked to go into a classroom and self-regulate, and this can be very difficult for children who have experienced trauma. So let's see who was in the lead here. All right, Jeanette, you're on. Look at that. They gave you a little fire. That means you are on fire, lady. But we still have our top contenders. Michelle, Eunice, Dorothy, and Jazz. You guys are rocking and rolling. Question number 4. During COVID-19, when considering early child care program, should you choose a STAR 3 or 4 program? Should you choose one that has written and observable COVID-19 procedures in place? Should you choose one that's open to family suggestions on how to make this process emotionally safe for children? Or do you say red, blue, or yellow? I will follow. What's your answer? All right.
Okay.
Oops, sorry, Sarah.
Oh, that's okay.
Go ahead, give your answer.
Okay. That's all right. So I closed all my windows, so you guys should be able to hear me now. It's okay, Dawn. I think I can remember.
Okay.
Everybody answered correctly, I think. Yes, all three of those you should follow. So when looking for a childcare program, definitely look for ones rated star 3 or star 4. That means that they are rated as high quality by the state of Pennsylvania, and you can find that star rating on the Compass website, which I will drop the link into the chat when we finish the game. You absolutely want to find a program that has COVID-19 policies and procedures in place. You want a program that stays up to date with the latest recommendations from the CDC, and one that is flexible with those recommendations and just putting the latest research into practice, because you know that will be the safest environment for a child. You also want a program that will hear the suggestions of the parent regarding an emotionally safe environment for their child. So as a parent, or if you're working with a parent, definitely let them know that they have every right to advocate for themselves and their family. They know what's best for their child, and you want a childcare program that will hear their suggestions on making that environment safe emotionally for their child, and implement the suggestions that they can. As Dawn was saying, it can be hard for a young child to start a new program in any scenario, and now we have masks involved, so you can't see the faces of all the teachers, and it can feel scary for a child. So it's important to make sure that programs are doing everything they can to make sure children feel comfortable and safe in this environment. So good job, everybody.
Yes, and we see Ash moved up. She moved into the top 5. All right, congratulations. Question number 5, things parents may want to know. Nap and soil clothes must be washed weekly. Meals will no longer be provided. Non-sick children may have to quarantine for 14 days. Red and blue, they seem true. What's your answer? Okay, so the correct answer is red and blue seem true. Parents that are, this may present a hardship on some of our families that are living in shelter, or some of our families that are going through an economic hardship at this particular time. But nap and soil clothes must be washed weekly. Although we recognize that this is a standard practice in childcare, it's not new, but we also know, for those of us that have worked in childcare, that a lot of times families would return clothes that were still soiled and not clean. But due to COVID, we have found that some childcare programs are choosing to wash the nap items and soil clothes internally. So we encourage parents to find out what the school's protocol is. And we also want parents to understand that even though your child may not test positive for COVID, if a classroom or a child or an adult has tested positive for COVID, non-sick children may have to quarantine for up to 14 days. So we ask that you be prepared for plan A or B. What are you going to do in the event that your child's childcare provider will have to close in for 14 days? That's a great amount of time for a family that needs to work to have to miss work. So we ask you to start thinking about that, and we ask shelters to begin to help the parents to start to think about how this might impact their work. And meals will still be provided. However, family style dining will not be in your programs, and schools are doing plated meals, or if you had to bring your lunch, a lot of them are doing bag lunches so that they are not bringing in contaminated lunch bags and things like that. So meals will continue if they were being served in your programs. So there's no worry there. All right, Eunice, she's back on top. All right. And Jeanette is a close second. And we see Dimples join the rankings of the top 5. She's quick on the draw. Our last and final question. When a classroom is closed, my child may still be able to attend school. You may be required to quarantine for 14 days. You should let your employer, shelter staff, and babysitter know. I'm thinking it might be all 3. What's your answer?
All right, so almost everybody got it right. I'm thinking it's all 3. So when a classroom is closed, your child may still be able to attend school. It really all depends on, if they had come in any contact with a child that might have been sick in another classroom. Programs really should not be doing transfers throughout the day to limit the spread of any kind of virus or illness at this time. So it is possible that if a classroom in your child's program closes, your child may still be able to attend school. However, the flip side of that is you may have to quarantine for 14 days, particularly if a child in your child's classroom tests positive. So as we mentioned, it's very important to then have a plan A, a plan B, and a plan C. So you might let your employer know and encourage the parents you work with to let their employers know, I might need to call out for a day or 2 suddenly if my child all of a sudden has to quarantine. I might need to contact a babysitter or figure out an alternative care plan for them. And it's important to let shelter staff know at that time so they can do their proper protocols, and just so that everyone's on the same page so we can limit spread of illness at this time. Good job, everybody.
Now let's see. Woo-hoo! Who are our top 3? Dimples, you're the 3rd in place. 3rd person, Jeanette. And let's see who's our winner. Eunice! Congratulations, Eunice, Jeanette, and Dimples. And our runners up were Jazz, and I couldn't catch the number 5. I'm sorry, I couldn't read it that fast. Okay, so well played, everybody. One of the things that I hope you guys gained out of this session is that with the COVID protocols, there's a great emphasis on health and safety, and we wanted to let parents realize and that that is the emphasis, because we want children to be safe during this time. However, there's very little emphasis on the social emotional impact that some of these protocols can have on children that are typically developing, and especially for children that are experiencing some form of trauma. So if you notice that we kept going back to the quarantine and 14 days, our families, if you can help them to plan now for how it may impact them so that they are set up for success. We want our families to know that if a child care program has someone that tests positive, they may have to find alternative child care for their child so that they can continue to go to work. And they need to think about that not in the moment, but before that moment happens. So that was one of the things that we wanted to emphasize. But we're going to spend some time talking about some other areas. But before we do that, are there any questions related to anything that we've shared so far that you want to share or you have questions about? We want to open it up right now for questions and answers.
And as people are talking, if someone has a question come to mind, feel free to drop it in the chat. I'll be monitoring that as well. So this could be if you're working with a parent and they have a challenge or a concern about childcare. It's kind of an open discussion Q&A at this point.
And you might have more questions as we share some information about our suggested protocols. It might prompt some thought that you didn't have before. And so we welcome you to join in at that particular time as well. And even if you have some insight about what your experiences are with the families in shelter. Just to help generate some thought, I would like to call Eunice Bay and have her share what she's experienced so far as she's reopened and her experiences with the children in her program. Eunice?
Thank you, Dawn, and hello, everyone. Thanks for inviting me to speak, Dawn. So we closed in mid-March, like many other programs did, because at that time, we didn't know that much about COVID-19. So we made the difficult decision to close our program, and we reopened June 8th. So it has impacted our program in a huge way. Definitely from the children's side, we noticed that from mid-March until June, children were staying with relatives. It could have been an aunt, it could have been an uncle. They may have experienced trauma that we were informed of, and maybe trauma that we were not informed of. A child came back, he found it difficult to self-regulate. There were a lot of children who just forgot routine, coming into the classroom, washing your hands. This is, now it's time for this, now it's time for that. So we really had to re-familiarize ourselves with the children and reestablish trust and let them know that we are here for them, even though they haven't seen us in months. Things will probably look different, but we try to definitely provide a safe, supportive environment, because when we reopened, we had to open with a policy in place in relations to COVID-19. What that looked like is drop-off and pickup procedures, as Dawn mentioned, is different. Now we have parents drop off and not, we don't like to say permit them inside the facility, because regulatory wise, we cannot say that parents can't come in. But to help mitigate the spread of COVID-19, we suggest to parents, you can drop them off between two doors. We will take their temperature. We will ask health questions. The teacher will escort them to their classroom. Mask wearing, children 3 to 5 initially were wearing masks, but then there was a mandate from the state, Dr. Levine's office, that said now children 2 and older. And initially, parents were saying, I'm not really sure about that. My child is too young, a toddler, wearing a mask. But then more data came out. And to be very honest with you all, they will cry now if they take the mask off. If we're asked, we tell the children to take the mask off. So that's new. Limiting non-essential items in the building, including strollers. So we are in a commercial building. We're located on the 4th floor. So strollers are located, if a family brings a stroller, located outside of the elevator. Sharing toys and cleaning is all day, cleaning, sanitizing, and disinfecting. So we have a soil bin in the classroom that is for when children play with a toy. Afterwards, it goes into the soil bin, and the toys are constantly rotated. This takes a lot of effort for teachers. but this is really what we do prior to COVID anyway, cleaning, sanitizing, and disinfecting. Now our cleaning practices are enhanced. As far as temporary exclusion of children if they become sick part of the day, we have 7 classrooms here, so we have the space to isolate a child if they come down with a temperature during the day. Many other programs don't. We have a policy on if you have been diagnosed with COVID-19, what do you need to do to return to the center? Visitors coming into the building are limited only if we only allow now early intervention therapists. If it could be special instructor, behavior specialist, language supports, because in the beginning, I think around June, OCDO suggested teleservices for children who needed early intervention supports. Now they're saying it's not a one-size-fits-all. Teleservices may not be effective for a child who really needs face-to-face supports. So we definitely have opened our doors, because that, when we talk about supporting the whole child, that we can do that. We are a team, we are part of a team to help support the child, help support the family, help support the teacher. So we definitely have allowed early intervention therapists inside of our program.
Eunice, can you share what the play has been like with the children?
Play has been different, but we try to make it be the same pre-COVID. So right now, it's kind of hard to tell children that you have to social distance. They don't understand that, right? So in early child education, we believe in creating safe, nurturing environments, giving children the opportunity to create, to explore, to discover. Well, now due to COVID-19, we're told there's sand and water play should be removed. So now teachers have to be innovative in how can we bring back sand and water, but maybe in an individual play way, instead of 3 children at a sand table. Blocks, children playing with blocks in the block center. We had to take out some, but there is enough for children to build. Dramatic play had to be different because they told us that we couldn't have cloth, so the children couldn't dress up like a fireman or a nurse or a doctor. So we had to be creative in the dramatic play. In the science area. So all of these learning centers, whether it's dramatic play, whether it's block area, whether it's science area, whether it's sand and water, we just have to be creative ourselves as educators and innovative to not remove play, which is how children learn.
Have you noticed a difference in anything in the things that they're playing or saying or doing?
Definitely. So due to the children being away from March until June, and they were at an aunt's house or at a cousin's house, any relative's house, the language of the older children began to sound like adults speaking. A 3-year-old spoke like a 10-year-old or a 15-year-old. So we had to be conscious of what was saying in the context it was said, and then notate that, because we want to make sure that a 3-year-old is someone speaking like a 3-year-old and not a 13-year-old. So those were one thing that we noticed as far as language with children, because they were in environments that could have been with adolescents or youth or adults for that matter. And sometimes as adults or older adolescents, we don't curve our conversation when we see our young children next to us. So that is something that I would encourage everyone to be mindful of, is that children don't really understand, I should say this when I'm home and not say that when I'm at school.
We have some questions in the chat. That was great, Eunice. Thank you. So I just want to get to some of these questions. Deanna said, I have a family whose mom is in CCP and she's concerned about daycare hours and losing her CCIS due to limitations of drop-off. Any advice in regards to this would be appreciated.
So many of the, I'm sorry, Dawn.
So I think she's talking in general, right? Not specific to your program, right, Eunice? I mean, right, Sarah? She's not, she wants to know what hours, childcare hours for in general. Am I understanding?
No, she has a specific family whose mom is in CCP, who's concerned about daycare hours. Oh, maybe you're right, in general.
Yeah, right.
Deanna, do you want to expound on that situation a little?
So if I'm understanding.
Yes, currently I have a family who's single mom. She has like 4 kids, 2 are school age, and I guess they're going to whatever daycare the younger siblings go to. They're getting in line for school. But I believe that like one of her classes for community college starts at like 8 o'clock something, and she said she could lose her CCIS or something. I need to get more information, but I just want to know, does anybody have information in regards to what's going on with the COVID and losing CCIS due to limitations?
So what we can do, Deanna, because this is a CCIS question, and we really want to be able to support your family on what the COVID social emotional impacts are, we will circle back and see the connections. We have some supports that can help you with the case management part of that. Look, Michelle, I think me, there's Michelle. So we want you, Michelle. We put your contact information in the chat. I do want to not lose one of the things that we want families, and I know we only have a short amount of time, and it might have to go into, and we're going to come back to the questions. I do want to make sure that you also see families, parents, from a social emotional impact. When we shared that our children are in a hyper arousal state, and I'll read to you what that definition means. When a family is in a hyper arousal state, or a child or an individual is in a hyper arousal state, it occurs when a person's body suddenly kicks into high alert as a result of thinking about their trauma. Even though their real danger may not be present, their body will act as if it is, causing lasting stress after a traumatic event. So when you're dealing with children that have come through trauma, when they are left at the door by their parents and their parents cannot come inside that building or that classroom, it may place children in a hyper arousal state. Their body and their minds are going into overdrive. They will not be able to process what's going on inside of the classroom, inside of the program, without a level of fear, concern, stress going on in their bodies and their minds. So childcare providers need to understand that, because you are removing from them their source of safety, of comfort. You're telling them, who goes into a building at 3, 4, and 5 years of age without their parent? And who is taken through the hallways into a classroom by one masked stranger, into a classroom with 2 masked strangers, into a room of 10 to 15 other children who are masked strangers? And now we've got to begin to process mentally, how do I form a sense of safety with somebody I can barely see? So we want to realize what our children, what's impacting our children. So parents, you might want to, one of our suggestions is ask the child care program, how can we set up virtual tours where it starts with intimacy, where the teacher can take off the mask and begin to talk through FaceTime, Google Meetups. Hey, how you doing? My name is Miss Dawn. I am going to be your teacher in the Turtles class. And I want you to know that you're going to have a fabulous time. Now, sometimes when you're in my class, it's going to be X, Y, and Z. And then blah, 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 blah. The teacher is explaining what's going on. And then some days you're going to see when you come in the door, it's going to seem kind of strange because you're not going to see me the way you see me now, but you'll see me with the mask. It's so important that you figure out ways to build safety and we're talking about emotional and mental health safety with your children at this particular time. The standards, the protocols are thinking about physical safety, right? We need to help the parents think about the child's social and mental safety, mental health safety. So you want to do that. And we're not going to be able to go through all the suggestions that I have. Unfortunately, time is just not going to permit. But some of the ways that we want to do is have routines and predictability. So if the virtual tour, if a parent can ask a school, I would like to see a virtual tour where the child knows exactly from top to bottom what to expect, because routines and predictability are important for children who have experienced trauma. They cannot function well without routine and predictability. So we want to see what should I expect when I drop off? Okay, it's okay to know that when you get dropped off, that mommy's not going to be able to come inside with you. And then we will help to have conversations with them about what to expect once they get inside of that particular school. Help them to understand what nap is. Let them see what nap is going to be like ahead of time. Help them to see what their playground is going to look like. Get there. Help them to see what the classroom setup is looking like before they get there. So all of these things are going to be important strategies that parents can take with their children. I'm going to jump ahead a little bit. Eunice talked about one of the things that the protocol takes away, and it's also something that those of us who talk about challenging behaviors often suggest that you have on a routine basis as a part of your curriculum, which is sand and water play. These sensory activities are very calming for children. And now that, you know, we don't want children all putting their hands in the same sand bucket, you know, because we know they wipe their nose or their hands and they put it back in the sand, but maybe having individual bins that each child can have their own sand box and they can have their own water bin. And so these are suggestions that I highly encourage childcare programs to begin thinking about. And when we start thinking about what parents can do from home, we want to be able to think about how you can build the language. They need to begin to express their feelings now more than ever, because they need to be heard. They need to feel like they're being heard, but you want to introduce them to words that will help you to understand how they're feeling. And this is a process, and I had a whole lot of opportunities that I really wanted to share with you, but get parents, get children, encourage them to talk about their feelings when they're at home and when you're out and about and you see other people, you see a child that fell and injured themselves. Ask your child, how do you think he felt when he fell? Or how did it feel when you watched Uncle Bobby play the game of ace spades and he lost? You know, how was he look? And then give words to those feelings so that children over time begin to identify different words other than happy, sad, and mad, right? We want them to identify these words, and you want them to expand their vocabulary, and you want to expand words to like lonely, afraid, brave, cheerful, proud, disappointed, fantastic, ignored, important, uncomfortable, safe, calm. These words we want to slowly build into their vocabulary so that when you're asking them how their day went, they will learn how to say, I was brave today, mommy. I went in by myself and I didn't even cry. Yay. And then you want to set the example for kids. You want to have them hear you express and put into words before they even begin to be in those positions. You want to say something like, as a parent, you're going to a new school tomorrow. Mommy will go with you, but because of the coronavirus, the school will only let the children inside. This is done so that not too many germs will get inside the building. Mommy's going to feel a little sad because she can't go in the building. How do you think this might make you feel? Now, that gives the child to begin to process. Oh, wait a minute. This is not something abstract, but this is something concrete that you're preparing me for, so that when I'm in that situation, I can recall what you said. I can begin to process that mommy's feeling sad, so it's okay that I feel sad too. Sad is not a bad thing. Scared is not a bad thing. Let them own their feelings and let them begin to identify some of the things that they feel. So, and begin to praise children when they use these words, and when you see them learning to express themselves, instead of asking them to be quiet or, or overlooking the value of self-expression. Observe their facial expressions and then give words to, did that make you feel uncomfortable? Oh, that's how I felt. Okay, so you noticed their facial expression, but they didn't say the words, but then give words to it. Did it make you feel uncomfortable? Uncomfortable, I feel uncomfortable when, and then it helps them to process. So sharing all of this is just the intro to what we really believe that families that are experiencing trauma need you to be their advocates on behalf of their children. This is, as I've shared with other child care programs, just in asking what their COVID policies are, they were like, Dawn, to be quite honest, whether these children have experienced trauma or not, this is what we need to be implementing. This is a consideration we hadn't considered for the typically developing child. And these are their needs as well. What is especially important for children who have experienced trauma. So I'm going to stop here. And if we have any questions that we want to address or insights, Jeanette is on the call. I just really want to welcome and circle everybody into this. Jeanette is a health specialist, therapist.
Yes. So we do have a couple more questions in the chat if we want to get to those. And I think if people have questions specific to CCIS, Michelle Robson put her email in the chat. If you'd like to reach out to her, we may have time for her to answer questions directly. We'll see. So Sharon put into the chat, what is the protocol if there is a child with COVID at a daycare center? Will it cause the whole daycare to be closed, or only the room the child is in, or people they have had contact with?
So the CDC guidance is very clear on what their protocol is. If you are in a child care program, you should have that in your handbook. That should not be a question if you're open. So, and if you are a parent, each child, the guidance, you will have to refer back to the child care program to see how they specifically have outlined what their protocol is. We will not be able to speak for all child care programs, but the one thing that child care programs are required to do is to contact the Department of Health and OCDEL and report their concerns and get their guidance from them as to what their particular next steps are.
So Sharon also put in another question. Would it help with face shields so that the child could see the teacher and other children without the scariness of the masks. This may lessen the trauma.
Face shields cannot replace masks. So you can both. Now, I may be wrong. I see Michelle, as they may have had an update, but I was informed that you have to have the mask because the particles can come out and around. The droplets can be exposed through the openings of a shield. So it cannot replace a mask. So that's what somebody, Eunice, said. I'm right. So you can't have one. You can't have the shield without the mask. You can have both if you want double protection.
Yeah. Michelle, do you want to jump in? I think you might have had an answer for a previous question.
Absolutely. Any questions anybody has, either email me or I could, talk here if we have time. If someone's having issues with their schedules, there's hours have changed, things like that, they can update us with their new schedules. So we could either get an employment verification form with updated hours, or if it's a matter of going to school, we could get an updated schedule and we could absolutely change your schedule to work that out. Also, if children who are school age are now going to the provider because their schools are closed, we can change that to a full-time enrollment. So they just need to reach out. I know it's been challenging for some people to get a hold of us, but you can contact me by email as well. So whatever helps the most, just let me know.
Thank you, Michelle.
Thank you.
Now, any more questions, Sarah?
No, I don't think so. But if something comes up, please feel free to drop it in the chat. Oh, here we go. How long is the documentation process normally take?
Is that a CCIS question?
I'm not sure. What kind of documentation, Stacy? For CCIS.
We're gonna let Michelle take that. We're gonna table that for this moment. But I want to make sure that you guys that are working with children that are experiencing homelessness, which is the Bell population, those who are experiencing any type of trauma, that you are intentionally speaking and working with your parents and preparing them in your case management for how they can, while at home, while in shelter, begin to think with the trauma-informed lens about the needs of their kids. Because we do not want to add trauma to trauma. That's the reason for this call. We do not. We have to be a voice for our kids. We see what happens when they show up into classrooms, and people call it challenging behaviors. That's their stress hormones acting out. They're operating in a fight, flight, or fear mindset. And we need them to move up in their brains so that they are working from the part that we want those brain connections to happen. And we need you guys to understand that now more than ever, nurturing relationships are important. We need you to help moms to see that spending time talking to and responding to the children is so important. I know that they're stressed, but their children's brain development depends on nurturing relationships. That helps those brain synapses and neurons and all of that stuff that sets the foundation for learning. We don't want to have COVID add another layer of stress to preventing that from happening. So one suggestion Sesame Street gave is that I loved it. It said develop a ritual. So when you're dropping the kids off, have the parents do some kind of hand ritual with their kids, a little mantra that they say, and give them a kiss and tell them to put it in their pocket or put it in their shirt, or put it close to their heart. And anytime you need it, just go and pull it out. I'm always there with you. And just a saying, I love you, I always will, and there's nothing you can do about it. They say it when they drop off, and then they say that to yourself every time you feel lonely, And then when you pick up and say, okay, so what's our saying? I love you. There's nothing you can do about it, and I always will. Whatever that is, that's reassuring and reaffirming for that child. It may seem like it's something small, but it's very important and significant. They go into those classrooms and they're by themselves. They need to connect. Ask the teachers, ask the program director, how can we build community? How can we show faces without masks? Is there a binder that we can develop that where I can see Jimmy without a mask in my little classroom book? I can see my teacher without a mask. These are suggestions that parents should be given so that when they get to the point of enrolling their kids, they can come armed with suggestions and strategies. Now this might be a stretch for some programs, but a t-shirt, if they feel comfortable with allowing, and we used to have me boxes when I was a program manager for a Head Start program, where they would have in their cubbies. We implemented this long before COVID, when the kids felt like their social emotional needs needed to be met, they could go to their me box and pull out something that was of comfort to them. So whatever that is, it has to be something that's in compliance with the child care program. But if it's putting on mom's t-shirt just to feel close when I get dropped off in the morning, she can't come in, but I know that that t-shirt is on the other side of that classroom door. And if I need that, I'll go put it on whenever I need it and put it back when I'm done. We did tapes for children where they could hear the voice of their parents and then go plug it into the listening center whenever they wanted to feel, they could feel close to their parents. They could hear mom's voice. They could hear dad's voice. So these are some of the suggestions that you want to do, and then remind teachers of the need to get your kids outside and open fresh air, playing and running. Hyper aroused kids need to get that stress energy out. So whether it's on the playground or whether it's through music and movement, they need both, okay? But we really encourage that. So I am going to stop with the suggestions, and I'm going to ask Ms. Marilyn to step in and give us our cheer and our challenge for the day.
Okay, hi everybody.
Hey.
So I have a parent cheer, and I made it real simple. So the purpose is to hope that the parents can use it for self-talk as they go through this process of getting their children into daycare. So it's, go parents, you can do it. Go parents, you can do it. Don't let them see you sweat. Don't let them see you cry. You can do it, you can do it. You can make us smile. So say bye-bye. And the reason why I picked that challenge, that cheer is, like I said, you know, you're going to need some self-talk. You're going to have to pep yourself up. And I was hoping to use some real simple words so you can remember it and go back to it. And maybe even with your children, you can do it. But so the challenge is this is going to be a process. And what all I've been hearing is that you should plan ahead. You got to go through these steps. The really good suggestion that I heard was, Dawn, you had mentioned for the parents to get a virtual tour. And that was one of the things I was going to suggest. If you can get, ask the teacher, make sure you have the teacher's name, but if you can get pictures of the classroom, pictures of the teacher with the mask and without the mask, and show it to your child, and so the child will know the teacher's name. So you say, this is Miss Dawn with her mask, this is Miss Dawn without her mask. Also, you can try to find out some routines and make sure your child know that you're coming back. You know, so you want to tell your child, I'll be back to pick you up after nap time, you know, so they can feel secure during that day and eat and do whatever they got to do in the classroom with the routines and everything, you know, and also even maybe do a trip to the actual daycare to actual see the facility and the door that they will be going into when they meet Miss Dawn with this mask on, you know, all of those things, and maybe more than one trip, and make it fun, you know. So I think all of those things would be helpful. And then on that day, when you take your child, that chair will be your chair. So you'll replace my name. So me doing this is go Marilyn. You can do it. This is that day on to the daycare. Go Marilyn. You can do it. Go Marilyn. You can do it. Don't let her see me sweat. Don't let her see me cry. I can do it. I can make a smile if I try. Bye-bye. I'll pick you up after nap time. So good luck to you all. Good luck, and I'll feel your pain. I'll feel your pain. Thank you.
That was awesome. I
That
love
was.
this, Marilyn.
I'm so glad we have that recorded so we can rehearse.
Yeah, yes. Uh-huh. I am. So I'm going to share my last slide with you guys. Last two slides. And here we go. Oops. I'm trying to do one thing. I'm trying to move the picture so that it reads, it's our COVID challenge to you guys is let it go. One of the happiest moments in life is when you find the courage to let go of what you can't change. And when I think of COVID, if we can turn it into a positive, I know people keep saying, I'm just over it. I'm just over it. We all are over it, but let go of that negative thought. We can't change what the health predicament is right now. So whatever you're frustrated by, let it go if you can't change it. I'm not saying lose hope. I'm not saying I don't want you to give up on things getting better, but understand what it is that we can change and what it is that we can't. And for each of us, that might be something a little different, but know what it is that you might have to let go of. And then this last little slide, I'm asking you, what step are you on? And each of us on any given day can be on any one of these steps, right? We're not always in the same place, but think about what step you're on today. And some days you might have to reflect back on this poster and think about what step you want to be on. So today, are you on the step, I won't do it? Are you on the step, I can't do it? Are you on the step, I want to do it? How do I do it? Or are you on the step, I'll try to do it? I can do it. Or wait a minute, I will do it. And then you get to that step where you say, yes, I did it. And whatever it is, we want you to celebrate it, whatever it is. So I'm asking you, you know, what step are you on today? And to take that challenge. And so what is it that you feel? I'm going to open it up, and we are at the close of what we have for you guys. We have more information, but if you want to see us take this and add to it in any particular way, please share that with us. You can unmute, share your insights at this time before we sign off. Thank you, Terry. Any information?
I'm wondering from our shelter staff who are on the call if there are additional concerns you've been hearing from parents that we could touch on in another meeting or perhaps touch on right now.
So it sounds like we're pretty good at covering the topic.
Jeanette,
I have
yeah.
a question. Do you feel that this information is relevant to our parents? Do you think it, okay. And have you thought about this and the social, emotional, mental health impact? I know we've been putting a lot of emphasis on health and safety, physical health and safety, but I hope that we have ignited something in you that will be an advocate, not only in this COVID environment, but that you also will understand trauma's impact on children, even post-COVID. But right now, it's really important. And go ahead, Jeanette. We can't hear you. We can't hear you, Jeanette. Nope, we can't hear you.
Jeanette, we still can't hear you. Do you want to try typing it in the chat, maybe?
Is this any better for hearing?
Yes. Yes.
Okay. Usually with Zoom, my computer audio is fine. I apologize. And a lot of good points were brought up about the emotional, mental health of people that are trauma impacted and kids that are trauma impacted. And something to keep in mind is that even for folks that are typically or maybe haven't experienced trauma, these past 6+ months of living in the pandemic and not having our typical coping and our routines, and for kids, they've been missing out on their social interactions and their friends. It's been challenging for everybody, and then especially for those that are coming in with previous trauma. And so paying attention to thoughts, feelings, behaviors is very important. And things are coming up that some are expected, some may not be. And there may be questions that come up as families are starting to get back involved in childcare and early education programs. So another thing is I'm happy to drop my contact in the chat as well. And if questions for mental or emotional health, social health, I'll put it, and I'm open to any kind of questions or conversations as well.
Thank you, Jeanette. I just want to mention, Deanna just put in the chat that she has seen a daycare program where the teachers wear buttons with their pictures on them without masks. So children can see the teacher without the mask every day because it's on their button. That's an awesome idea.
And one of the suggestions was, and I got this, and I can't say that I came up with this one. I borrowed this from a hospital. The hospital had the nurses and the doctors put laminated 5x7 pictures around their chest. They hung them so that the patients would not be afraid seeing them coming in with all of this gear. And it was a big old 5x7 laminated picture of themselves. And if childcare providers could do that or a button, you know, that would be awesome. Thanks for sharing that. And I'm just reading the chat because it's hard to do the chat and talk, guys. And so we'll make sure that anybody that wants to know, we'll put our email addresses in the chat. So if you want to reach out to us for any follow-up.
Yeah, and we can also make sure to send the slides out and the recording of today's workshop. I'll put my information in. And thank you, Jeanette, for offering that. It's a really good point to bring up too.
Okay, everybody. Well, we thank you guys so much for joining us. We look so forward to connecting with you guys in the future. Nice meeting people that I'm just meeting for the first time.
Thank you, everyone.
Bye-bye.
Day.
Thanks, Marilyn, Jeanette, Eunice.
Yes. Marilyn, I loved that cheer. I'm going to remember
See you
that.
guys. Thank you so much.
Bye. Good seeing your faces.
Yes.
We got to come back over to some of these.
Oh, should we end the recording?
Oh, yeah. Yeah. How about that?
I went in the kitchen to get my